If you're a bloke who suffers from premature ejaculation or have problems getting a good erection, you're not weird, you're not even unique, and you're not alone. Talk to AMI about their nasal delivery technology.
This is only one of the advertisements from the Australian Medical Institute. It has been notorious for its sexually explicit advertising since the business started in 2001, with mixed responses from the public. So far, according to spokesman Richard Doyle, the AMI has treated over 300,000 patients for premature ejaculation and erectile dysfunction. But Mr. Doyle has told UOW News via a phone interview that while erectile dysfunction can be a precursor to heart disease, the medication prescribed is based on self-diagnosis by the patient with little or no physical examination. The head of sexual health services at Port Kembla Hospital, Dr. Catherine Brown, says this is a concern because the problem might be caused by an underlying illness.
In terms of the premature ejaculation, people often are just anxious, so you need to be able to sort out, is there an issue? Have they always had an ejaculatory problem? Is it a secondary problem to anxiety because of a particular setting? And do they have another health problem that is in fact associated with it? And with erectile dysfunction, things like diabetes, cardiovascular disease, smoking, excessive alcohol use need to be looked at in relation to the function, because those things may be addressed and then the problem may not be so bad, or if they're not addressed, the person may continue to have major health problems going on that nobody's looking at because the patient's only concentrating on the fact that they can't get an erection.
We asked some members of the public what they thought of the AMI's approach to its advertising.
I nearly crashed into one of the signs on the highways on the way home from university.
They're just trying to sell a product and they're doing it in the way that's easiest to sell that product. If people are trying to sell like people not speeding, then they do it in a direct way, showing people dying in car crashes. So having a billboard saying longer lasting sex is just the same thing, I guess.
The ones that I've heard on the radio, they play them at the wrong time. They're playing at like 7 o'clock in the morning when kids are getting ready for school and stuff. And I'm just in the back of my mind, I'm hearing it and I'm going, relevant, but not at this time.
Yeah. Well, I think if they're going to like learn about sex at the same time, like at a young age, like say when they're 12 and 13, they should know that they're probably going to come quickly as well anyway, so it's good to know there's a solution out there.
But Dr. Brown approaches this much more seriously.
I think that any advertising that concentrates only on your ability to get an erection and how long that erection is going to last, how strong that erection is going to be, really devalues men, because people are not looking only for a relationship where the penis is the only thing about a person.
The AMI even markets to couples who do not have problems with premature ejaculation or erectile dysfunction.
For those already getting there, you could intensify once, twice, 3 times.
What are you waiting for?
Dr. Brown is opposed to prescribing treatments where there is no problem.
Medically, I wouldn't consider that to be a good move, and I'm not keen to prescribe people medications they don't need, so I wouldn't do that.
She says that patients should be wary when considering such a treatment.
The Healthcare Complaints Commission did undertake a review, and the outcome of that investigation was not entirely positive in terms of the facilities not always having the same stringent controls that you would expect of a pharmaceutical company, for instance. The issue in some of these organisations is that they don't have that quality control and that they don't have the same safety standards in terms of storage, in terms of infection control in relation to putting things together and not getting contamination.